Hi everybody. Hi, my name is Bill Ho. I'm the officer in charge of ADPC Academy. I just want to extend a very warm welcome to everyone who has just joined us for this ADPC Alumni Forum 2020. Before we start, I just want to update on the very small technical glitch that we're actually currently experiencing. Due to some of the setting issues, some of the participant names are not displayed correctly. So if you can open up your participant list box, and if you see your name should be appear in the first place. If that says show as Nata Wood, but where parenthesis me, please hover your mouse over to there and then click on more, and then you can actually then rename and change into your name. So we do have to apologize for this small technical issue. We have roughly an hour and a half for this very important event. So I just want to go through some of the housekeeping rules for this Zoom meeting. The meeting is recorded for the reporting purpose. So if you have any issue with the meeting being recorded, please do let us know. And we do have a chat box. We would like to encourage everybody to utilize the chat box to type in your questions, or you would like to share your ideas and suggestions. Please do so. We have a team of staff who's actually constantly monitoring the chat box. We'll make sure that all your questions and all your comments and ideas are shared with the moderator and with everybody else. And of course, we only have 1 hour and 30 minutes, and it's our great pleasure to have more than 100 people sign up for this meeting. We do have to be conscious about time, so we'd like to ask everybody to be short and concise in terms of their intervention. So with that, we'd like to hand the floor over to Aslan Pervez, our Deputy Executive Director of ADPC, who will be serving as the moderator of this important meeting. Over to you, Aslan.
Good morning, everybody, and to some good evening. I can see colleagues from the Australia and the Pacific, but I think most of us from Asia, Africa, we are still in a good morning mode. Some of us are really very good morning mode. So I really thank all of you to come. Let me just, for the sake of the time, we have been longing for this particular event for a long period of time. And today, with over 130 people registered, and I hope that from by the time we start 5-10 minutes, most of the people will be connected. The main purpose for this meeting was not really to have a training or a lecture session, rather than bringing all of you in one frame. And we are very thankful, but at the same time very excited that I can see at least 54 people in my laptop. Some of you I have learned from you. I can see some of the people with whom I have worked, some of the people I acted as a trainer. But very excited to just give you where we started in 1986. In one corner of the Asian Institute of Technology, through the Outreach Center, and starting a course called Disaster Management course. Today, this year, if things are all okay in the remaining part of the quarter, we will be running the 50th year of the DMC course. So just imagine that it is not about the 50 years ago, but in the earlier stages, these courses were being conducted twice and thrice in a year. Starting with a training institute, ADPC of course has grown and now has attained a full-fledged international status. But training and capacity building remain the core of its heart. Today, when I'm looking at it and the ADPC Academy, we have covered more than, let's say, almost all the continent, but more than 26 countries in the last 34 years. And in over 10,000 of the registered alumni. But if I say that the number of people trained, it can go much above 20,000. Our courses has been from a simple disaster management to any specific hazard related one to health risk management. But now here we are today, and today at the umbrella of what we call the ADPC Academy. And for this purpose, we have gathered today. So I will just hand it over to Hans to glance through some of the new normal at ADPC. Over to you, Hans.
Thank you very much. And indeed, very welcome to all of you across Asia and the Pacific, and of course beyond in Africa and perhaps elsewhere in Europe and otherwise. As Aslam mentioned, in 1986, ADPC was set up as a region's training center for disaster management. And capacity building was rightly identified as a key approach to address the lack of capacity at many levels in the region. But now it's 2020, and 2020 is now 1986, and much has changed. And although the need for capacity development in disaster risk reduction and in climate resilience, broadly speaking, remain very current. But indeed, 2020 is not even like 2019 when we talk about these issues. The impact of COVID-19 has struck to the heart of not only the health sector and not only the economic activities and consequences of increased poverty and vulnerability, but also onto how we are conducting capacity building. For the moment, gone are the standard classroom teachings and workshops, for good and for bad in some cases. And face-to-face workshops bringing together participants from around the region or even globally is not happening to any extent any longer. So the question then is, where are we now? And as rightly pointed out by Dr. Tedros of WHO earlier this week, there will be no return to the old normal for the foreseeable future. And COVID-19 is still wreaking havoc around the globe and disrupting the normal. And what we have is the current normal, and what we can expect in the near future, or what can we expect in the near future from the new normal, is the real question when we're talking about looking ahead. So the new normal is a normal where capacity development is still needed as much as before, and perhaps in some cases more, and where many tried and tested approaches are difficult to implement now. And there are opportunities and there are constraints and there are new approaches. But how do we then reinvent capacity building for our current situation? Well, we can group it very loosely into losses and gains and how to move forward. After 4 months of working from home, which is my case, it is easy to identify what has been lost in online meetings and workshops. There's no real coffee break discussions any longer. There is no opportunities for impromptu sideline meetings that were triggered by a presentation or an interesting event at a large meeting. Follow-up dinner conversation doesn't really exist any longer, etc., etc. We also lack many of the non-verbal cues, which helps in bringing and building confidence when we entrust with each other. And we are learning new table manners, so to say, in online meetings. This is a good example. I think we are still testing some issues about how to work on here. Now, gains. Well, what are the opportunities? Well, we can have ease of participation for many of us. Expectations to travel to meetings have been reduced. And much of the opportunities lies in how we can leverage technology. Proficiency in communication technology has increased. So the way forward would be take the best of the gains and reinvent how to address some of the more significant losses. Let's bridge those gaps and get more engaged and enabling technology. And I want to wrap up by saying we have this meeting, as Aslam was indicating. We're reaching out to alumni and myself. I don't have the privilege of being an ADPC alumni, but I recognize the potential of having you all engaged. And it should be part, it will be part of ADPC strategy over the next decade, to provide greater reach technically and geographically. And I trust today's session will be a good starting point and a building block for how we can construct an effective approach for capacity development. So I have great confidence, and I hope we can all leverage all of your capacities together with our capacities. And as our alumni, I look forward to learn from you and see how we can work together in the near future. Thank you very much.
By the time we really open up for our question and session, let's hear from some of our key speakers, and you already know them. So let me first invite Jonathan Abraham. Hi, Jonathan, over to you.
Well, thank you, Aslam, and thank you, Hans. I'm very happy to join you here today. It's a great privilege to be part of the ADPC community, part of the family. It's a very rich resource in terms of experience, expertise, and knowledge. And I'm very much looking forward to this forum to hear your insights and views about the current situation and how to move things forward. I would like to also say thank you to ADPC for inviting my colleague, Dr. Gaia Gamhuage. She's currently attending to an important issue, and I hope she'll be able to join us later in the forum. She's been a real inspiration for WHO emergencies programs work on learning and capacity development. I'm also excited that this is a forum and it's not a webinar. We've had some very good webinars, of course, but this is an opportunity to exchange ideas, and very much looking forward to hearing from all of you and learning from you and indeed all the ex-directors, the current directors, the staff, and so forth. But let me get into this straight away. Don't have much time, and also give the opportunity for everyone else to speak. I just wanted to raise a few points. Essentially, these are questions, if not hypotheses, that also merit further evaluation and, of course, reflection and evidence. What is happening, of course, is that all of us, all countries are responding to the COVID-19 pandemic, and arguably we should better say that as managing the risk of the pandemic, as we know there's a difference in how we conceptualize the challenges. But whilst this is happening, we can also anticipate a flood of reviews, of evaluations, of inquiries, which are not going to just look at the performance, but also are going to be making recommendations for future needs and priorities for capacity development. And therefore, there's a role for people like you as ADPC alumni, ADPC, and organizations like WHO to see how you can contribute and participate in these reviews. How can you ensure that they are going to be effective processes and that they reflect good practice and principles of disaster risk management and resilience? For example, are they just going to focus on response, or are they also going to address prevention, preparedness, recovery, and of course, capacity development? These reviews are also tremendous opportunities to capture experience so that that can inform future learning and capacity development. And similarly, with all of the work going on in terms of assessment of socioeconomic impact and recovery, how can you influence those processes such that the principle of build back better is applied and we can reduce future risks? So let me also talk about health. Well, clearly COVID-19 pandemic is bringing us all together and has promoted a lot of innovation in our approaches. But in terms of health itself, health is really a shared interest of all of us. It's a shared outcome to which we are all contributing, whether it be a healthy life or whether it be reducing deaths and injuries and illnesses or promoting health and well-being. It's not just a sector, it's a system where all of the stakeholders are working together to support health. Of course, in terms of the COVID-19 pandemic, there's a close association of health with outbreaks, but it's not just outbreaks to which health is vulnerable and exposed to. So, and it's also the case, of course, that COVID-19 has affected many other parts of society. So this leads us to a key issue in terms of how does health and other sectors work effectively together in the future for capacity development? how has the All Hazards Disaster Risk Management systems, plans and capacity development activities truly integrated biological hazards, epidemics and pandemics into these processes? And what can the respective sectors learn from each other? Health sector is good at certain things, other sectors are good at other things, and how can we bring that together more effectively? I'd like also to move on to the issue of learning and capacity development. I mean, as we know, capacity development is about strengthening systems, organizations, programs, sectors, and also individuals. It is important, of course, that individuals within the system have got the competencies to perform their roles effectively, but essentially it's not enough. We also need to look at how to link learning more effectively to human resource development. Looking at the workforce itself, we need to expand and strengthen that workforce. And then the question is, where should the focus be? Well, certainly in the health sector, it needs to be at the community and local level. How can those people who are working at the local level, community health workers, the nurses, the family doctors and so forth, they have critical roles to play in emergency and disaster risk management, particularly on prevention. So how can we work with them more effectively? The other thing I'd like to say is that there still needs to be a focus on strengthening the coordination capacities, the managerial, the leadership and governance capacities. And in this regard, the ADPC FEMAP course really focused on leadership, on management, both operationally in terms of capacity development and risk management. So that still holds today. The final point would be in relation to the fact that most people in the health sector, or health professionals, career professionals, have got some sort of degree, some sort of qualification. But to what extent have they had any exposure in their learning to health emergency and disaster risk management? And I think the case is very little. So there is an issue in terms of how ADPC, other learning institutions, organizations like WHO can really work together on integrating health emergency and disaster risk management into these respective learning programs, and really speak to the issue of mainstreaming our work on building resilience into all of these learning programs. I think that's particularly the case that I wanted to raise, and I'm sure there are many more, and I look forward to hearing from you all. Thanks very much.
Thank you, Jonathan. And we see a lot of questions, and we really want to quickly get back to this interaction. So keep all your questions ready. And let me just quickly move to my friend Merrick Chatfield. I think perhaps the longest serving resource person in the disaster management course yet, because even this year we are planning. I hope we can reach to you online this year. So over to you, Merrick. Merrick, you are mute. Merrick, you are mute.
Is that better? That is better? Okay, I'll start again. Greetings, everyone. And I'm so pleased to see so many familiar faces out there. And I'm so happy to be here with you and working with you and trying to explore this key topic. Interesting topic, interesting challenge. Our speakers already have touched on some of the issues that we're facing, some of the issues that we have to deal with. When I thought about the topic, I thought deeply about what I could say that might be useful in this context that we're dealing with. So I have some remarks. The things that I'm going to say, I'm hopeful will add to the debate, will make us thoughtful, and will help us in developing some sort of outcome which will meet our needs and will help us be effective in the business of humanitarian work, the business of development, the business of disaster risk reduction. So there's some thoughts. Obviously, we can't say the whole story. There's a limited amount of time, but I'd like to think these thoughts will be sufficient to at least take us on to the next few steps. Now, first up, I'd really like to emphasize the comments made by Director Hans, Executive Director Hans, in that we are currently facing a new normal. There will be new normals in the future, a time of considerable change. I wanted to specifically mention that because that's very relevant in terms of some remarks I'll be making shortly. The fact that we are in a time of change, change has occurred, and change is likely to continue occurring at a rapid rate. It is indeed an uncertain future. So that's a key comment. Another comment just before we get into some of the points that I want to make, and that is on terminology. Already there's been a number of things mentioned. We all have a different view on what some of these terms mean. We have standard terminology published by various agencies. I would like us to consider what we all think we understand from words like e-learning, capacity, capacity building, capacity change, and tracking. I'm going to try and use a standard understanding of those terms in my few remarks that are coming up, but I recognize that terms may need further enhancement, may need further definition, that many people may in fact see the terms differently. So if I could just flag that as a caution that we need to understand, sometimes when we use a term, not everyone perhaps understands the same thing from that term. And I think that is an issue to be considered as we move forward into developing e-learning systems. Next thought I wanted to share was that we need a bit of a sense of what e-learning might do for us. We're talking about introducing e-learning activities. We're talking about developing the system for e-learning, adding it to the mix for our capacity building activities. I think when I was thinking about it, I thought there's quite a few things that e-learning offers us as an advantage. These are the features, if you like, of e-learning. One of the things I believe that e-learning does for us is that it can make information and structure readily available to us in our learning activities. Once we commit something to the digital world, it's there for ready access. So that information, that structure, those tools, if you like, that we develop are all readily available. And that's perhaps something that is a feature of e-learning. It also helps us with our record keeping. We can make records easily. We can store those records. We can access those records. We can readily exchange information derived from e-learning activities. It's easy to transmit. I know that we still have many people without access to internet, without access to computers, without access to a substantial amount of the technology that we have. Nonetheless, our current technology does give us options, and even some of the most remote villages that we could imagine could still access some e-learning technology in one way or another. For example, we can take electronic media to remote villages. We can use solar panels, battery power. We can use technology even at very remote locations. So I think we need to recognize there is a variance in access to technology, but there are also solutions in how we can enable remote communities, low technology communities to actually access some aspects of e-learning. Nonetheless, the point I made is that e-learning in whatever form and whatever part we're accessing does enable us to access and exchange information quite readily. And that, of course, is across borders, across cities, within a country, across cities. E-learning truly enables us to take a global approach. I guess there's a few other features. We're all familiar with those. Flexibility, particularly in the fact that we can combine e-learning with many conventional face-to-face techniques. It is inherently a very flexible tool to use. And of course, we're already using a number of e-learning technologies. So I think one of our focus points for this discussion today is how we can further use it, how we can make use of what's currently available, as well as we try to identify what else we might need and what fresh tools we might need to develop. Now, when you put together what's available, what we're currently doing, what we think we might like to do, and the difficult circumstances that we're in now and likely to be in for some time, I think it's reasonable to conclude that e-learning is a very necessary approach. It gives us numerous options other than the options which have been cut off, those things that have been withdrawn from us, those things that are now difficult. E-learning is presenting as something which will solve problems, give us further options. I think that's probably the biggest promise for e-learning, is that it really does offer us the opportunity to be problem solvers. So that's a point that I wanted to make. So we get on to the point that I'd like us all to think about in this forum, the topic that I've been allocated, and that's how we might go about developing e-learning tools, e-learning facilities, and e-learning system. And I'm talking about this rather than just tracking, because after I make my remarks about developing the system, it should be fairly clear that tracking is bundled up in that approach that I'm suggesting, and the approach that we may well decide that we could take. So first up, I'd like to make the point that it's probably unwise to attempt to design a complete system before we start rolling out certain activities related to that system. I'd like to suggest that we could develop a few representative activities in the first instance. Once they're developed through a process of review, discussion, collaboration, generating inputs, use of networks, the sort of things we're doing today, through that process, the initial products can be evolved. And they'll be evolved based on the experience of using the products. They'll be evolved based on the needs of the agencies and the organizations that are using the products. They'll evolve based on the contributions from participants. So the idea is that rather than spend a long time developing a system before we roll it out, that it is better to develop individual components, a few selected ones in the first instance, use those, have people go through the activities, produce the outputs, apply the outputs, and then learn from what is achieved and apply those learnings to further development. So that's, I think, a fairly key point to make, bearing in mind the current context, bearing in mind the difficulties that we're facing, and bearing in mind the enormous number of choices that we have. Better to begin with a small range of activities, consult with partners, provide inputs, and develop them progressively and have them become more effective and more useful for us as time goes on.
Mary?
Yes.
We have to move to next, and then we will come back to you. Is this okay for you, Theo?
That's fine. That's the main point that I wanted to make, is the idea of evolution, iterative development, beginning somewhere at a small level and then further development in very close partnership with clients, stakeholders, and users. That's my main point. I hope that's useful. Thank you.
Thank you very much, Merrick. I think we take note of this, and I think the new normal and the future is that how we really reach a large number of people through an e-learning and online and courses. One of the very interesting question, I was just looking at it coming from one of our alumni from Bangladesh, is that internet accessibility and availability is not that perfect everywhere, and particularly where this whole capacity is being materialized. That means at a very, very local level or at the community level. So he really wanted to know what exactly are some of the tools that we can do. He has some suggestions. We will come back to Mr. Aminul Islam later, but let me now introduce and give it the floor to my teacher. Actually, she was my first teacher on disaster management way back in 1999. Zen, over to you. Your video is, your audio is mute.
Yes. A very pleasant good afternoon to everyone. I'm so excited to see my former colleagues at ADPC and my fellow learners. There's so many now that I could see, and probably I have met some of them, if not all of them. Well, that include you, Aslam. Now, I would like to, before I proceed to my chosen topic about plugging in, as always, the community learning community, let me I'd like to infect everyone with some positivity regarding what happened with the current situation of the pandemic. That I'd like to call it as a new normal to become new, better normal. We should be positive. It should be better normal than before. And also, we're so used in saying social distancing. It's actually not accurate. We are physically distant, but we are socially very much connected. Like what happening now. Can you imagine? We never gathered in at ADPC training 100 people in one room. But now we have gathered so many in one room. And therefore, well, we may be physically distant, but we are very socially connected. I could not see myself. Yeah, I could see the name of Aslam. Okay. Anyway, yeah, I could not see myself. But anyway, I could see you instead. Anyway, so because of, well, that's just preliminary. And I would like to talk about the learning community. How can we continue to support the learning community? I'll go down to the very local learning community, not the academic community or the ADPC community, but the very local community. How do we continue to support them? And we define this learning community as those who stay at home, those who could or may not access internet. I'm so happy Merrick mentioned that, you know, everywhere you are, you can access, that there are challenges with that. So those who could not access. And the third one, most of these people who don't access or who could not access are those actually the frontliners. So these are the three qualifications of the what we call learning community at the local level. How do we continue to support them? So there are several parameters or probably areas of concern. From the ADPC point of view, how do we reach them? Okay, from the government point of view, how do we reach them? And from the CSO's point of view, how do we reach them and support them during this time? So let us marry all together those scenario in reaching the community of learners at the local level. One key issue regarding that is the setting up of a mechanism prior to situation like this. But since the situation was not like that, we were not prepared to a pandemic like this that will last forever because it was not within our lifetime. The last one we had was in 1918 to 1920 where about 50 million people died. And so, but we do not have the summary, or there's not so much materials to learn from, especially on the learning side. And so that means in the current situation, we were not prepared. We are very much prepared, and with the natural hazards. We know the ins and outs of preparation, prevention, mitigation, response and recovery with regards to natural hazards and disasters coming from natural hazards. But for a situation like this, we were not prepared. Perhaps we were, with the help of WHO, in terms of outbreak, epidemic, and short pandemic, but not in a situation like this, where now millions are affected, and you know, everybody's lives have been affected or is being affected. And so, but we are more concerned, or I am more concerned about those learning communities at the local level. So first, at least I hope that after this or during this, we could document some issues, some experiences, and some learning already happening, because we may know, but there are so many activities going on in capacity development at the community level, but we don't know because we have no access and we have not reached them all. And so if there is one way we could gather all together all of this learning and shared with people, so document these cases and facilitate a shared learning activity wherein people can communicate their experiences in times like this. Another point that I want to plug in is that instead of using capacity building, can we use capacity development? Because we're not beginning from a scratch, or we're not building from scratch. We are in the science of continuing development. So we are developing the capacity, or each one is helping develop the capacity of each other. And at the same time, it's not about building. It used to be capacity building, but now I think it's time to use capacity development. Okay, so going back to the community, there are two tracks: the government, the formal system, and the CSO, or the civil society organization, or NGO side. So from the government side, the system is developed already, but again, I am referring to the natural hazards. In the last 10 years, the government has prepared the system and has developed the system in terms of in terms of capacity of the people, of the government, up to the local level. Maybe theoretically for some, but maybe for others, it's also theoretically and practically. Okay, so that formal system can be used through the government and through formal leaders and leaders of the community. As much as we want to, the principle of community-based disaster risk management is the participation of all. But in this time, in this crisis time, we need to rely on community leaders. And in that system, or in that track of from the national to the regional to provincial to municipality up to the village level. So we need to rely on the village leaders. But there has to be monitoring and accountability system. Okay, there's so much to explain on that side, but then, so that's one track. Another track is the CSO side. The CSO's reach is more limited compared to the government, because they are only there based on their priorities. Not unlike government, they are everywhere. So with the CSOs, they are there only because of their priorities and because of their partnership with the communities. So they rely mainly on their partners. And with both of these tracks are using or should be using their constant communication and developing IEC materials before anything like this, because as I said, now we know how to prepare on things like this. If we will recover, I'm sure we will be recovering from this, but then we have to be prepared on this. And these are two tracks: the CSO in the government. The CSO relies on community partners, but common is the monitoring. Common system that should be installed is monitoring, constant communication, using of IEC materials, and the essence of accountability and shared learning. And then, so while this track is going on, there must be a point in time wherein there should be a shared learning, wherein there should be a facilitator for that shared learning. And I think ADPC has a very important role in gathering all these experiences, distilled the experiences, and come up with guidelines and validate this system and propagate the system so that we will be ready. And the learning communities are also ready, and they know what to do. And this kind of system also feedback to the old, not really old, but the common system, which is the natural hazard system, so they could feedback each other. In fact, the pandemic like this could learn so much also from the hazard, like the risk assessment. The risk assessment should have been taken advantage of by the governments to be used during this time. Because in some countries, what happened was the community-based approaches was thrown out of the window, and a control and command system has been placed. But that is probably the necessity at this time. So at this point, I'd like to end my presentation. There's so much to say, but you know, we know that time is limited. Okay, thank you very much.
You will have some more time to interact. I can see a lot of my colleagues. So now I think my colleague Gaya also has joined, but let me just hand it over to Loy. And most of you know him. So I just hand it over to Loy first, and then of course we have some questions, then Gaya, and then go back to the rest of the session. Over to you, Loy. You are mute.
Mute. Okay. So I've unmuted, and I think most of you can see me. It's very satisfying to see the faces of so many people whom I know and get introduced to the new people whom I don't know as yet. I'm sure I'll come to know better. I'm very proud of ADPC setting up the academy and naming the academy. So this is historically a old thematic area for ADPC. It is, however, a new rich operating concept for the region on the capacity building agenda, and it will help other regions of the world. It is articulated by a pioneer institution with a regional and founded and situated in a highly disaster-prone region. Only is an early pioneer. The Academy has a three-way goal structure, help to build and strengthen capability of government agencies, organizations, and communities to reduce the impact of disasters. Secondly, and this is important for somebody like me, facilitate and promote partnerships and networks and build training institutions, partnerships with academia, and enable experience sharing and lessons learned. And of course, the third one is an old slogan which we used to use in ADPC right from early days, which is maintain recognition as a proactive and responsive regional resource center for training services. Now, I did a little bit of homework, both from the ADPC website and my own data. And I see that we have conducted 183 training courses, public training courses, with a wide variety of participants from across countries. And these are 4 generic courses, 86 of them, 49 hazard-specific courses, and 48 tailor-made thematic courses. I will share this data on the chat so that people know it later. We've also done a number of national courses, and these are too numerous to actually accurately reflect. But I'm very glad that there is a systematic database, both on courses as well as on alumni. One estimate on the ADPC website talks about 14,000 alumni. Aslam mentions closer to 20,000. I can see hard figures for the last few years of about somewhere between 8,000 alumni. It's interesting that 4,800 of these are from the 10 countries, and of which 9 have become founding members. So it's very interesting that we've served the founding members, even though we were not conscious of it. Of the 7,200 participants for which records are available, 66% are from national and local government. This is an amazing figure for me. I didn't realize it was so high, and I would love to see the disaggregation. 16% from the community, 7% from development cooperation partners, 5% from UN agencies, 4% from academia, and unfortunately less than 1% from the private sector. Out of a sample size of regional distribution of alumni, 87% are from Asia and 6% from the Pacific, which means a significant number is from our region, which is a good thing. We can also influence and affect other regions. That is a good thing, but we have done it in the past. Now, the vision of ADPC Academy, which is articulated very clearly, is to serve as the capacity development arm of ADPC, be globally recognized as a center of excellence, and focus both on DRR and CCA. This is mentioned in the ambition. CCA, there's been limited work done. Much more work can be done. Serve the region and other regions in building and enhancing national and subnational capacities. The ADPC Academy will run its flagship courses, but also assist its specialized technical departments in conducting TNA, training design, preparation of background material, course delivery and evaluation of the other courses. And this is done in partnership between the academy and each of the other 6 technical departments. So this is important to understand about ADPC, and I'm glad that so many of the technical departments are participating today. We aim to create a state-of-the-art capacity enhancement and professional development services, have pedagogical tools, technical applications, simulations and packages. And the Academy is expected to establish, strengthen an active network of both ADPC alumni. In fact, this is a very important thing, something I truly believed in when I was at ADPC, and I can see that it's operationalized today. It may have been operationalized before as well, but I can see it very active today. And we need to see this as an important first step and continue with doing this. We also recognize the links to the NDMOs and their national level training arms. And we have seen that capacity development has occurred in Myanmar, Indonesia, Sri Lanka, India, Pakistan, and Ethiopia. And we need to look at some of the other countries where work has been done. I remember in my days, a lot of work has been done in Cambodia. Interestingly, it's got the highest number of alumni. So how many more minutes do I have? So anyway, while particularly articulating its core areas as DRR and CCA, its 6 thematic areas of the departments are cross-cutting themes. It achieves greater clarity in its role in preparedness, which is interestingly enough included in its original name and has been operationalized in the recent times. Also, role in response and recovery. And I'm glad to see that the current reorganization of ADPC articulates both response and recovery in its branding and in its operational activity. The deep-rootedness of the RCC, the hosting of meetings in 13 member countries, the establishment of the Asia Preparedness Partnership, its risk assessment partnerships in the Mekong, and the bold new initiative with the World Bank are some of its strengths. The global pandemic may shake all of us. It has certainly disrupted face-to-face training courses, which ADPC used to organize, but it has opened up new range of possibilities for online work. And I have participated in the second online activity of ADPC that I'm participating in. And frankly, I've learned a lot from these, and I hope to learn a lot from today. So this is a new opportunity. what are the potential value adds that this can bring. So strengthen national and subnational institutions, provide value added through regional perspectives, support periodic and continuing learning, both through e-learning as well as periodic interactions. It could be over telephone as well, as we are doing today. Promote and support partnerships and networks, not just at the regional level, but more importantly at the national level and at the national level. And we have examples of each of these from ADPC work. For example, I'm terribly impressed by the work done in Bihar. I know the work done in Cambodia and some of the regional levels. I know the work done in Sri Lanka in some of the provinces and cities. And, we also need to recognize the duality of ADPC strengths. It's both a regional resource as well as a national and subnational resource. And therefore it gives our partners opportunities to contribute. Today, by convening this meeting, we should take this as a new initiative and take this forward. Thank you. And I look forward to hearing more and contributing more. Bye. Not bye, I'm here.
Thank you very much, Loy, and thank you very much all my colleagues. We still have Dr. Gaya, and she has just joined, but allow me to now have a little bit more interaction with our alumni, and then I bring in Gaya. So please do not mind this slide change here. I think I have been reading all the questions, and in terms of the new normal and what we are going to do this year or later, one of the things that keeps coming and in the chat box as well is about the online training and capacity building and the fatigue attached to it. I have just seen so many questions asking, some in terms of the speed, some in terms of how would you reach where there is absolutely no internet. I know that in most of the places we have, but still I don't think that it is 100% compatibility. Also about online training is creating fatigue. So over to you, any of you, and I just want you that if you are using your computer, down here, I mean in this screen, you have this called reaction. And if you just put in the reaction one, there are two options available. One is your thumbs up and one is your palm. If you put the palm one, then I would consider that you want to ask a question. So I now open up for what we call live question and answer, that anybody who want to ask. So let me first ask Edwin Igusi, my friend, and then I will go to others. So please, I'm very happy to see you. Yeah, please, you unmute and ask or share your question, but keep it only for 2 minutes maximum at this moment. I'm very, very sorry for that, but yeah.
Thank you very much. Thank you, everyone. Good morning in Nigeria. It's about 10 o'clock now, and I'm glad to be with all of us. I am from Nigeria, Ahmadu Bello University. I'm a professor of disaster risk management and climate change. I was at ADPC in 2014, where I did the course on DMC. I think that was course 24 or 42, I can't recall now. Merrick, I could see Merrick. Merrick was one of my teachers there. And it's quite interesting to see quite a number of you who were resource persons. But one of the things I thought we should be talking about now, it's how do we pack issues of exercises, practicals, workshops, and things like that into this e-learning platform. One of the things we so much appreciate and love about ADPC is that it is rich in exercises, it's rich in workshops and simulations. But when you now go to e-learning, how do you bundle all of those things and put on the platform such that we can still have that rich learning that ADPC is known for. Thank you very much. Aslam, thank you.
Hello.
Aslam?
Yes.
Did you hear me?
Yes, I can hear you. So I took note of your suggestion and the question.
Okay.
I mean, and I think this is a very important thing that, how we now create those field exercises or simulation exercises that actually can help. Before I pass it on to some of our speaker or Hans or my colleague Lino, is there any other colleague who would like to ask or share something? I can imagine.
Can I ask a question? I'm Guru Naik.
Oh, yes, Mr. Naik. Please.
Yes, I think while I'm quite excited that we are actually talking about e-learning, because I'm from Kabul, and each time we have to come to ADPC in Bangkok, we actually have to make a plan. I mean, it's not that we can actually come anytime and every time we want to. So e-learning gives us an opportunity to actually participate in more than one training programs or any number of programs that we, so it will be cheap, it will be easy for us. So I'm excited.
Okay, thank you.
But the only thing from my side is, as a participant, I'm just wondering, when I am actually taking this course from my office, I'll always be pulled for different office works. And how do you as a coordinator ensure that actually working 8 hours on the program, not really getting pulled into different things that I have at office?
Yeah, thank you, Guru. I think let me just pass it on to Anil first, and then of course to Victoria to share her experience. Yes, Anil, Mr. Anil Sangi.
First of all, I am very thankful to ADPC to call for this alumni meeting. In fact, I attended one of the 5th regional learning workshop on mainstreaming disaster risk reduction in 2015. And I was working as a joint secretary with the National Disaster Management Authority, and for 5 years. Later on, I worked as advisor with the Ministry of Communication, where I have taken this ICT in disaster management in the forefront in the country. So one thing is very clear, some apprehensions are there that telecommunication reach is not in the lowest part of the villages and all that. But what I feel, the kind of training we used to have in ADPC, where there are a number of constraints in reaching ADPC, maybe financial constraint or maybe the time frame, a lot of things are there. But now it is much better that we have a wide spectrum where geography is no binding. Each and every person can come on, and knowledge, expertise, everything we can harness. Is that we have sufficient time to attend such seminars and workshops widely spread all over the world. The only thing is, somebody mentioned about the fatigue. We should not keep it more than half day, because I was interacting within the country in India with a number of ICT related programs. Even half day is more than enough every day. If it is done like that, is very good. Secondly, one question came from Mr. Edwin that how you do the this practical and simulated training. Those also I have seen in number of ICT training programs in electronics. They are able to develop that sort of program. Maybe much, it generally suffice to 70–80% of the learning which we do in the physical form. But we have to do a lot of work in designing those practical and simulated models. Those, I think, over a period will be able to excel in that direction and will be able to do it. Thank you.
Thank you very much. May I now hand it over to Victoria? You want to share something? Victoria Pitan? Hello, yes, you can speak louder. we cannot hear you at this moment. So let me just switch to my other colleagues before I hand it over to Dr. Gaya. Santosh from Nepal. You have been one of our supporter and guide as well as a participant. So I know that you have been minutely observing the recent changes within ADPC's Academy one. So I really would like to share your reflection or anything that you'd like to share now. Over to you, Santosh.
Namaste. Hello, ADPC team. It's great to see you all. Last time you took me by surprise. I was not prepared for this. One of the things I would like to point out is, as I've done on the chat, is any online training that is more than 2 hours is a problem. Our focus is diverted. Even if you are at home or you are at work there is a lot of distraction. At home there is more distraction. So in any scenario, I do not think anything more than 2 hours is productive. And I'm saying that because I just finished 7 hours a day, 2-week-long training that I had to do on USAID system to maintain my certification as a AOR COR, and it was painful, absolutely painful. So I had to do it. I did it. So saying that online trainings will never ever replace in-person trainings, conference meetings, never. And then there are certain topics like the ones that we are dealing with ADPC Academy, where we have to have hands-on, more interaction with the community, CBDRR type of activities, the health type of response planning that we work on cannot be done online. It can only be a temporary measure, but not a permanent solution. Saying that, I will stop now and let the rest of the people chime in. Thank you very much.
Thank you. My last question for this round, Omar, you want to share something? Omar, you want to say something? I'm just surprising some of you.
Hello, good morning. This is Omar from Saudi Arabia. I'm very happy to join your ADPC. You are our center. They provide us to be a team member with Mr. Merrick and some of. I want to share because the e-learning, it's very important to us to be, and it's not a new thing to see how is it work, how's the time, or how it will be the benefit of it. But I think it will advise us to be good to using this e-learning in this situation or in the future. Thank you.
Thank you. Thank you. So now the last one, Mr. Abdul Rahman Mohammed. Please unmute your Mr. Abdul Rahman. Over to you. You have to unmute it. Okay, so we're facing certain challenges. So let me now very quickly, I think we have, let me just take the time. So I think the overall discussion so far that we had, one of the things that we are challenging, that as we have to move for temporary or maybe later as well for course or the training and capacity building, which cannot be face to face all the time. There's some of the challenges that we mentioned. One, of course, is about the connectivity, but more importantly, people talk that how we manage learning and building systematic capacity by modules and by e-learning platform. If you allow me, let me just get over to Dr. Gaya, because she is one of the architects at the WHO Academy, and we really want to learn from her that particularly in this situation, I know that the situation not remain forever, but this has already taught us a lesson that, you know, a kind of situation might happen in future, or in case if it happens, how we actually would or continue to impart capacity building across the board. So Dr. Gaya, over to you for the next 5 minutes.
5 minutes. Thank you, Aslam. And my sincere apologies to Hans, yourself, and everybody else. I had a medical emergency and had to go to the hospital, and my brain basically lost track of everything. But I'll really try to use the next 5 minutes to interact with you. Thank you so much for inviting me. I'm really honored to be in this forum. I'm from Asia myself. I'm originally from Sri Lanka. I know of your institution. I'm very grateful Jonathan pulled me into this. I think it's wonderful to see you not just training people, but bringing them back and trying to harness their thought to move forward.
Head of training. Exactly.
Okay, I can hear another voice. So I am currently head of learning and capacity building for WHO's health emergencies. And as Aslam said, obviously this has been a really busy time for us. On January 26, even before a public health emergency was declared, we realized that we needed to get training out to the world. And we started very quickly, and we launched our first course. Since then, we've launched 13 courses on COVID, but they actually end up being 100 courses because we have 38 languages. And I'll explain to you why these languages are so important. To date, we have nearly 4 million user registrations on the openwho.org platform. You can all go on it, you can access courses. And what have we learned from this? We've learned that we have to be very fast with content during an emergency. So when we have a pandemic is defined by a global outbreak that is usually caused by a novel virus. We don't know anything about it at the beginning, but the nature of real-time training in emergencies, it's not necessarily what you do, but what we will have to keep doing is to figure out how, I just want to put my timer on so that I don't get too long, but Aslam will let me know. How to get the content, be sure, get it transformed into good learning material and get it out there. And the Open WHO has been able to do that because we set it up before the pandemic and we did it. And I think the characteristics of it are useful to you. So the first thing we decided is we need speed and scale. So we have technical experts in WHO, we have systems in place, so we have speed, but we need to scale up. How do you scale up globally? It's all the things that I've been hearing since I've been on this call. If you're confident of the content, do people have connectivity? A lot of people don't have connectivity and they have different types of connectivity. So what we did is we have low bandwidth forms and we have also an offline form via an app. So that's one thing that we did. How do people actually absorb what you're teaching them? It's not about delivery, it's about what they take. That's where we go to local languages. I saw there was a colleague from Nigeria just now, and just to let him and others know, we have 8 African national and local dialects. We have Yoruba, we have Swahili, we have Hausa, which is relevant, I think, to Nigeria. This increases people's ability to absorb this and interact with it. We also have to look at cost. All our courses are free, but people pay for data. People are paying for data. So if you produce something that is heavy in data, that requires you to pay for data, that will also be another problem. We realize that use of devices, I have a mobile phone, but I don't know how to use all of it. And now we're working with the International Telecommunications Union to look at how we can increase the digital skills of users, but also of the teachers, right? We were very comfortable going with self-paced courses. Here's my course, come and take it, do what you like, get the certificate. That era is over. We have to deal with the same experience. We have to provide the same user experience for the participants that you and I are using for face-to-face trainings and even simulation exercises. Several of you mentioned this. So let me just not take too long and just raise a few things that we've learned. So definitely we need a shift in mindset. We cannot just say people don't have connectivity, so we do nothing about it. We have to work with countries to give connectivity. We have to bring all of this together. Our approach when we are doing online facilitated training has to be like face-to-face training. We have to take time and effort to connect the learner with their previous experience, connect the learner with learners with each other, and connect the learner to the content. We really have to have a higher level of facilitation skills in the teachers and higher level of learning skills in the learners and the peers. I think we're going to have to really do a lot of training on that. And I think what you are doing and what we hope to do now and also through the Academy is really foster a culture of lifelong learning. So it's not a training, but it's part of a learning pathway to build individual and national capacity. And I think we really have to look at location. As you said, people are trying to learn from the office or from the home. For certain things like simulation exercises, we have to arrange in the National Emergency Operations Center or another facility that has interconnectivity for people to come and enjoy this. I'll just finish off with the Academy. So I've been leading this work for health emergencies, but we have a bigger project for the whole of WHO and beyond called the WHO Academy, which we hope will be operational starting next year. And this will really take some of the good practice we have and apply it to all of public health. It'll be open to everybody, to anybody who works in the domain of public health, but it will also be the center of training for our staff so we can support our member states better. We will harness the technology that's out there. So there are ways to do immersive training at low cost with low connectivity, and we are trying to work that out. So I think in summary, what I'd like to say is I really appreciate this collaboration with ADPC. I'd like to work with you on building the new environments and the teachers and the learners of the future. You are very, very experienced and we'd like to learn from you. And I hope that we can collaborate going forward. I'm also leading work to develop a learning strategy for the future of public health that will shape the Academy but can be available to you as well. And I really invite your alumni to participate, contribute, and we will figure out more concrete ways to do this. I hope that's enough, and thank you, Aslam. I'm sorry if I went over time.
Well, thank you very much, and I hope your medical emergency was not that serious, but thank you very much. I think some of the points are really, really very good. I just promise all my alumni colleagues that after this meeting, you will have everybody's email ID and name and everything, so that if you want to interact with them further, you can do. Now, let me just come back to maybe Hans at this moment, because not because of the COVID situation, but more importantly, over the last couple of years, and particularly starting from 2018, there has been a serious thinking within ADPC, because we are now branching out from Bangkok to many countries. We certainly have a number of country offices here. We have programs even now running for almost about 13 countries. Now, this is a great opportunity for the ADPC Academy utilize these services. At the same time, also have a partnership or a linkages with some of you. For example, I mean, this is an alumni meeting. I have no hesitation to say that, you know, my colleague Abdul Latif, who I can see here on the screen, you know, served ADPC in 2002 or around that time. And then now he's back again helping us to connect the emergency operations center related work in Bangladesh. And this is exactly what we want to harness through this partnership, that, you know, all of you, my colleague Omar in Saudi Arabia, for example, any help, any support that ADPC would like can further help after the Saudi Heart project we do. So we do have some of the things in our mind. I would just hand it over to Hans, and just to highlight what are the thinking that we are having, what we call it as the future of ADPC Academy, and then connect with you further in the next 5 to 7 maximum minutes. Over to you, Hans.
Thank you. And thank you for all of this very rich inputs. And illuminating discussion. I think there's a number of things that have been touched upon that are extremely pertinent to what we're doing. I mean, we're talking about uncertainty, and uncertainty is really the situation we are in now, and there will be changes. Terminology was mentioned. I think that is critical, as Merrick pointed out also. We may talk about things, but we may understand different things about it. The digital divide is an issue that needs to be overcome. And we need to do concerted effort together with our government partners, our private partners, but also with the tools, as you're saying. I have a mobile phone. I'm probably using 10% of its capacity. And likewise, there's other opportunities in doing all of these. But I think what comes across to a certain extent is to build on what works, but also reinvent some of the ideas around capacity building. It was highlighted, let's not have longer than 2-hour sessions or maximum a half day when we're doing things online. But how does that gel with the past when we had 2.5 weeks of specialized training in mass casualty management? That requires a thinking again of how can we use innovative approaches, simulations, computer assisted approaches, as well as leveraging, as I think Gaia, you pointed out very succinctly, in saying we have to leverage the EOCs, we have to leverage the different places which has higher level of connectivity in order to be able to not only be constrained by the minimum and the lowest common denominator. Now, there's also this issue, and I think, again, Gaia, you were great in highlighting it, that we've had and discussed in the past. Whenever we're talking about reaching out to large groups over the internet, language is an issue. We can't just do it in English, and that causes a lot of issues. And it's not just machine translation. You have to do it contextually. So I think that's important. There was raised the issue, and I think it was again Merrick who raised this, about being modular and sequential, being evolutionary in the approach of trying and moving forward with small steps. But at the same time, we are pushed to do things rapidly and scale. So how do we deal with that? Now, can we leverage technology better? Can we reach out more effectively to the underserviced groups, as mentioned before? Can we design systems that are fit for purpose? We have global participants, we have professional participants, and we have local participants. And I think here, ADPC is going to, at least when I'm working with ADPC, we need to lean into the great resource that I'm just sitting and looking at on the screen of alumni for ADPC. Because you, as Aslam pointed out, you are in the countries, and we can work with you, we can draw from your experience, but importantly also, ideally, we can work through you when we cannot be present there ourselves. And I think there is commitment from ADPC side in seeing how we can strengthen this relationship as we move forward. Now, ADPC will leverage the Academy more effectively, and not just as a training department, but we need to also work on reinventing the pedagogic approaches. Now, online learning for disaster risk reduction and climate resilience. We have online, we have blended, connect with country resources, technological innovation, etc. There is a lot of potential, but we have to sift through what works. And there is a lot of bad examples of online training as well. So we need to make sure that we are not just digitizing everything and put it up for people to read, because that's not necessarily going to create the learning outcomes that we need to be cognizant about, because ultimately that is how you measure success. Not just that you have delivered, but that people actually took it up and, most importantly, use it for betterment of the world and the local areas. So you can expect ADPC to put more effort in here. But before I leave, I think I want to pose a challenge. I sort of lament that for the last 50 years, when we work with computers, we still have only emulated the typewriter for putting things into the computer, or pen and paper in terms of scribbling and text recognition and all of these things. And there's perhaps a tape recorder when we're talking, and there is a translation in there. But there's no new ideas really of how to be able to use the input technology. I've seen some science fiction where you have 3Ds, working with the databases and all of these things in space. So the challenge for me is then, how do we take a fresh look on learning, using all of these opportunities and thinking outside the box, and not just trying to emulate the workshops, not trying to emulate the classroom teaching, but trying to come up with something new and innovative in how we are getting learning experiences and capacity across to people more effectively. And I'm looking forward to taking this process and discussion much further, and looking at the opportunities, recognizing at the same time the constraints that we are facing currently, and hopefully to a lesser extent in the future. But with that, I'll hand over to you, Baslam, and to take it further. Thank you.
Thank you very much. Thank you, Hans. And we certainly have to take this further. Before I count on or put the takeaways as been asked, I again open up for some more interaction and question. If there are no hands raised, then let me take that liberty to ask, of course, my mentor, supervisor, colleague as well, and currently also associated with ADPC, Mr. Arambe Pola. Of course, he has served for ADPC for so long, but the way he has shaped the ADPC trainings and capacity building, both for the flagship as well as the training under programs. So I really would like to hear some reflection from Arambe. If you can unmute your recorder. Thank you very much, Arambe. Can you unmute? Yes. No, again, yeah.
Yeah, thank you, Aslam. I am not prepared to, say anything, but I'm first I would like to congratulate and also to, thank everybody who has been, a big strength for ADPC, and also, for the connectivity. I also feel that, what Hans said is correct, that, we also should think about, conducting trainings using this new opportunity, not to go back to the same era of, classroom training. So you have to see something, out of the box. I especially, think that, in our training, we had some difficulties of, training the government officials, because normally, they don't have funds, so they will not be able to travel to, Bangkok to do training. So this kind of, neglected audience that we can still reach through the new, methodologies, because, now since we have this sort of facilities, we will be able to, do the training with them. Especially, now we can see a new development, because now most of the government agencies are taking over the disaster management portfolio in a large way. So therefore, this type of training is very essential, and we can use this new opportunities actually. At the meantime, I think we should go into new areas, and also, rightly somebody said that, we should have, limited time, and so that, people will be able to work and also do the training actually. So I don't want to have, more time on this, but thank you very much again to everybody, including you, Aslam.
Thank you, Arambe, and for taking time and being here. We are almost 4 minutes, so if anybody would like to share or suggest something, it is your time. We have taken note of all your questions. I don't see any hand. Yes, I don't see any hand. So then let me do the difficult one, which is what we call the takeaways, before I hand it over to my colleague, Bill. I mean, for me, first and foremost, I think this is reconnecting with you is, for me, is the biggest advantage today that I have. And for the next 48 hours of the weekend, I really would mesmerize the some of those people I met. I mean, I can just see that in 2002, when I came for the CBDRR training, my colleague George I can see him here. He's currently serving the deputy director in one of the big institute in India. I can see many of you. The takeaways is about, first and foremost, that in this situation where we are not able to conduct face-to-face training, taking the cue from Gaia particularly, that how we actually can scale up the one which is already existing. So partnership and networking at the global, regional, but more importantly at the national and subnational level is very, very important. Use of technology, and I think what some of my colleagues brought, this one is very, very important. Like, for example, I just share with you that involving the information and technology regulators in the country. For example, Gaia mentioned about ITU, but we, ADPC Academy and ADPC program is working with ICTA in Sri Lanka, for example, that how our damage and loss assessment training can be uploaded online on that one. So I think make use of the information and technology over the period of time. We, from our academy, as we were mentioning, that we are continuously converting our face-to-face training course on an online and on an e-platform mode. We certainly would share with you, but I just wanted to here highlight that after a few months, we would be conducting at least 2 online fully online course, which is one is on the gender and one is on disaster risk communication. I think another one is about the co-creation, and this is where I think we would request most of our alumni to help us identifying some of the ways of reaching out to the institutions as well as the new programs that is coming up in the country, so that ADPC Academy can tie up with them. More than the individual training that we have been discussing or we have talked a lot, I think this is also the time that we have to also look that how we think about a systematic capacity development. What it means is that until yesterday, ADPC was able to attract one person from each of our department in different countries to come over to Bangkok and get a training. Right now, the demand is that the entire Ministry of Public Transport in Bangladesh, they actually want to have a training on resilient transport system. And they're seeking services from ADPC. ADPC alone cannot do it. In order to do that, then we have to look at it that how we build the capacity of a relevant institute in Bangladesh so that they can continuously do training and capacity building on resilient transport and other things. With this, it is already 4:30 here in Bangkok. So I just hand it over to my colleague Bill for the closure. But I just promise that all your questions are noted. The people who have registered, we already have your database, we will share with you. But this is actually a beginning of the new relationship that we would like to have and seek more support and more partnership with you. Thank you very much for your time. Over to you, Bill.
Thank you very much, Aslam, and thank you so much, speakers and alumni, family, friends, and members, for your really, really valuable comments and suggestions. We do apologize if we weren't able to sort of answer them right during this meeting. We definitely are capturing those questions and comments. We'll definitely share with everybody after the meeting. And this is not the end of our get-together. I see this as only the beginning. So we'll try to actually organize a few more events such as this, try to reconnect with more of you so that we can actually really achieve what set out to do to reduce the risk of disaster to vulnerable communities. So with that, we'd like to thank you again for taking time out of your busy schedule and joining us this afternoon. Want to wish everybody a very good evening, a very good day on Friday, and hopefully that we'll see each other very soon. Thank you so much. Enjoy your day. Thank you. Bye-bye.